Hello, welcome for this webinar, Sébastien.
We hope that you had a good day. We had a great day in our clinic, and within this webinar, he should last about 20 minutes. We want to illustrate the masterclass we are doing in the Congress, Les Lumières.
In Firenze, in Italy, in Florence, we said in French. And let's talk about a masterclass where we will introduce to you the 2D, 3D, 4D concept, which is, Sébastien, from the first consultation, digital one, until the treatment planning session.
Exactly. So through this day, we will bring a patient, and this is the aim of the masterclass.
Real patient.
Real patient. And on the real patient, we will go from the first consultation, all the photos, all the videos, and we will develop everything on the workflow.
Exactly.
Until
to harvest, to collect all the data from the patient, and also with the laboratory part to understand how we can manage those data to improve our practice and to do the session planning.
So to give you an example, let's take another patient. Let's say it is this one, and you will see through the clinical case that we are explaining here, you will see what you will have in Firenze.
See, the patient asks us, I just would like to eat in a normal way to feel good with my mouth, which is a very good goal for a lot of patients in our clinic.
So we begin by the discussion.
Yes.
Discussion with the patient, understanding his aims. And then he says, I cannot continue like this. And I think we all share the same kind of patients. And what we want to share with you is the workflow. The 2D, 3D, 4D workflow is a way to organize your clinic so that you are doing always the same process. And this is very important.
The same process using digital tools. We know that digital tools are very important in our practice. However, we have to maintain all the time, the first goal is to treat our patient, to understand what are the values of the patients before using the digital tools, which is so important for us.
So what would you do for this person? What would you do for your grandfather? Because he's 82 years old, and we have to find a solution so that he can chew, just chewing. There is no major aesthetic outcome here, but still he is happy to live and have a good smile. He would like to have a good smile, and here is his situation at the first consultation. So those photos are very necessary for the patient to understand.
And we always start with taking 11 pictures of the patient, 11 in intraoral photos, and 2 different way in extraoral in the first consultation, digital consultation.
And not calculation.
Oh, it's not the same.
Yeah. So the photos, and we will perform the 12 photos in the patient in Florence. And we want to show you that if you train your team, you can make 12 photos in 2 minutes. And this is very important if you want to do it at each patient. So we always do the same thing for every patient.
At the end of this consultation, we will see it, we are able to, through the photos, the pictures to the patient, to understand and to educate the patient what is doing in this mouth.
So we will do the photos and we will discuss with the patient in live, and then we will also use the new tools with AI for the analysis of the photos, for the radios, and of the explanations. We will do it as we do it always for every patient. The idea is to go through the complementary examination also. We will bring the photos, but you will see also this is Diagnostic, the analysis of Diagnostic.
Diagnostic is a software where using the 2D and the 3D part of the radio exams. And you can see with a simple way to explain to the patient what are the different problems in his mouth. And simply, in a simple way, you can see the periodontal disease, of course, if there are any decays, if there is any infection. And those photos or those X-rays exam can be also sold to the patient at the end of the first consultation.
Yes, so we will share all the data to the patient very easily through the new items. We will use Ascara as the new AI analysis of the consultation, of the wording of the consultation, and Diagnocat for the status. Also, you can analyze the status, and you can analyze also the cone beam. Look at this in the status, how Diagnocat will measure the depth of the pocket, the periodontal pockets. But then, this is the status, and then you can have this for the CBCT also.
CBCT is not only for the implant therapy, of course. You can use it to look at the periodontal disease, as we said, but also for measuring infection, for example, endodontic treatment problems, if you want. Or you can see here to explain to the patient what are the problems that we can see on the teeth.
So let's go through this process of analyzing the patient. From this situation, then we have to build a treatment planning and a treatment proposition to the patient. So on the side, you have the patient, you have the values of the patient, his age, what can we do for this person? Logically, at 82, you want to perform a simple treatment that will be the last treatment needed for his life. He cannot come back in 2 years or 10 years to redo anything. So it has to be efficient, safe, quick in the realization.
And we have to do a final, as you said, Sébastien, a definitive final way, a specific treatment. But thinking about also the problem of brushing the teeth of the patient, because he's 82 now. Probably is able now to brush in a perfect way his teeth. But what would be the future in 10 or 12
exactly.
or 15 years? How will be able to clean the teeth? And the gums too, we saw there was a big periodontal disease problem here, an issue, and we want to treat it first, of course, but we want to think about the future in 10 or 12 years, sorry.
So, we have been going through the 2D photos. We have been going to the radios in 3D and in 2D also. Then we go for the 4D, and the 4D is the analysis, the functional analysis through Mojo. In Florence, we will have the live Mojo session with our patient so that you can understand the setup of the Mojo. You will see the live Mojo, and we will make the analysis of the Mojo and the functional analysis for the TMG, all the problems.
Thinking about a real diagnosis before thinking about the future treatment, of course. Understand how your patient is chewing. It's so interesting, it's so important in order to do a good treatment at the end of the treatment session planning.
So it is for the diagnosis. Mojo will be done for the diagnosis, but then you will understand how you send this to the lab so that it does streamline your workflow. Because what the idea behind is to be very precise in the clinic and not to redo things. Everything has to fit correctly. Let's go through the diagnosis part.
Many teeth has to be extracted. We've got, of course, a very important initial periodontal therapy that has been done. And we have to think about the video. It's not a bad way now. We can conserve, we can keep this video in that way because the guidance is okay, the adjustability is okay. So let's work in a simple way, maybe, Sébastien, in this case.
The aesthetic part is something important always, but it's not the major point here. And this is why in this very situation, we will not make a mock-up, an aesthetic mock-up for the patient because it's not what his demand.
However, in Florence, we will do in this masterclass session, we will do a mock-up for you with a real patient. We will come with us in France and Italy to understand what are the trips, how we can manage the first part of the mock-up session in the mouth, but also how do you manage the after treatment session with the computer part of the treatment. How you place the first video, the second one, to compare the first and the second. So interesting for you to understand that.
You will have the mock-up design on SmileCloud, and we will make a live SmileCloud with the designer so that it's the same way you could do it in your office. How do you work so that it is very fast to do, because you ask somebody to make the design for you and you make it together. So you will see SmileCloud live, and then we will have the mock-up inside the mouth of the patient. This slide is very important because it is the base of the 2D, 3D, 4D concept. It is the value-based medicine. We have to go through this process where we understand, we educate the patient, and we build together with the patient the aims of the treatment. And in this situation, the first point is health for his mouth. Second,
and for the person, the body itself,
and for his body,
of course.
Getting rid of all those bacterial infections he has inside the mouth, because he is, for anybody, for sure, moreover when you are old.
Yeah.
And then we have to restore function and chewing function. And in the third part, it is aesthetics. In some patients, you put aesthetic first because that's what they are expecting.
In this case, health first, comfort in second way, and third way, aesthetic.
And then we go for the treatment, the thinking about the treatment based on the data we have been collecting just until this point. Now we can make our thinking. We will go for the periodontal therapy for sure, with many extractions, but trying to save most of the more we can. And then we will go through a temporization in the posterior and fixed prostheses in the anterior. We will use some implants to stabilize the fixed prosthesis in the anteriors, and we will have a removable in the posterior parts.
At that time, we have to think about talking about money with the patient, of course. And during the masterclass, during the day, we will explain to you how we manage when we will talk about money, about price, about devices in this case. And during all the day, we will talk about economy of this concept. Because, of course, it's so important in our clinic, in your clinic too. And talking about money is not a problem for us, for sure.
So, because you have a good organization, and thanks to digital, a treatment that would have been done without digital, maybe in 10 rendezvous, shall be transformed in a treatment in 4 rendezvous. And this is how you deal about economy. And because we will have been doing a good work before the clinical part, then the clinical part is very fast. And this is where you save money. And in this situation, we will treat the patient in 4 rendezvous. Let's go through the digital strategy now. Designing the treatment is a main thing with the lab.
We always say that we have to think before doing anything else, and we have to design before treating the patient. And that's why we will ask to the lab, thanks to the data we have collected before, to think about it, and we will guide the lab to organize a good strategy for this treatment.
You will see during this session, this masterclass, how do we use Mojo and Sphere. Sphere is the new device from Mojo to streamline the connection between the clinic and the lab, so that the lab can use all the movement of the patient for his design. And then we will have, and it's a co-working situation, because you can invite in your consultation anybody, and the lab can work with ExoCAD or another software anyway. Now, the lab strategy to design, we have documented a way to rebuild the whole mouth, the Octa digital concept. You will go through this idea, but you have to understand how you deal with occlusion there.
You can see here that we used to use the face scan, and during the masterclass we will explain to you how we will use it, when we will use it, and why we will use it. In which case we're going to use face scan or not. Important for you to understand that.
So once you have the design, and it's very important to understand this, but it takes time and it's another situation. Once you have the design, then we go for it in clinic. First thing is perio-sanitation, initial periodontal therapy. Splinting, look at the upper incisives. I did splint them so that they don't move, so that he can just chew a bit. I will take them out, but I will take them out in a good situation. I will go for it with my guided surgery in a good situation.
And we can check with this kind of treatment the healing of the patient. Will he be able to have a good healing for the gums? And you can see here, thanks to the second picture, that we can see the difference between the first one we saw in the first consultation and that one would be so different after maybe 6 or 8 weeks, no more.
Yeah. And the patient education to periodontal maintenance,
yes.
So that now the patient, he brushes, he understands what's going on in his mouth, and this is done by digital, by showing the photo. The patient sees from the first consultation, wow, this is my mouth.
What was the problem?
And he understands. Then, because you have the design, you can go for the treatment planification. From the treatment planification, in this case, we go for X-guide.
Yes, we always, in case of extraction implantation, we always use a digital surgery, which could be guided surgery or navigated surgery, doesn't matter, in order to place in the right way, thanks to the first design, in order to place in the right way the 2 implants in this case. And of course, it's a lot of problems that we place outside the box.
In the same way, because as we said, we will transform the mouth in just one rendezvous, we will put the implants and we will ask the lab to build the removable temporary
posterior
prostheses. And you can have those kind of removable that are done by digital. And the pleasure of this is that it is very precise, you don't have to change anything.
This is a big session, of course. It takes maybe, I don't remember, 2 hours, 2 hours and a half, thanks to surgery, extractions, and then place the temporary. But it's a lot of time that we earn before, thanks to the design, thanks to the thinking about the treatment.
So everything is built before the surgical rendezvous, and then we go for it during this surgical rendezvous. Look at the quality of the periodontal.
Exactly.
This is improved by the patient, by the scaling, by the patient, so that now we can work in a good condition.
You mean periodontal therapy works? In the south of France.
And then we go for the surgery. Okay, so we place 2 implants in the upper. The surgery, upper and lower, did last for an hour and a half because we went also through the extractions in the lowers, with the gums, with the bone grafting, whatever. And at the end of this, we will screw the temporary immediated loaded bridge in the anterior in the same position we decided before. So then the workflow is this one: implants and surgery, then scanning with the iOS. In Florence, we will make the iOS with the iTero.
iTero, to see a different way to use your scan. Maybe some of you use also iTero. We can, in a different way, explain why we could choose this one or another one. But it could be interesting to see in which way we're going to use this one.
In this case, implants are ankylose. The biomaterial is allograft, collagen matrix, and SmileCloud as a communication tool, and you will see this in Florence. At the end of the day, at 5 p.m., the patient gets out of the clinic like this. So he has the immediate loaded bridge in the anterior, printed in onyx by its print tray. And he has also an immediate temporary fixed dental bridge in the lower, in the anterior, and he has the two removables on the posterior that were done before.
We used to offer a cap at the end of each treatment, of course, as you can see here.
The idea is that because everything has been done before, when you go for the surgery, this is when he goes on the left side, on the right side, it does work. You don't have to touch anything or make a small equilibration is normal, but it's not something you can be confident in the realization of the prosthesis.
You mean we have to have the same on the computer, the screen of your computer, than in the mouth? Because it's always a beautiful way on the computer, and we have to check. We will show you in Florence in the masterclass day. We have to check if it's the same on the computer than in the mouth.
Exactly. And at the end, the prostheses are performed in ceramic, and he has his removable denture partial denture in the posterior. Nothing sexy here. This is why we wanted to show you this kind of daily patient. This
real life.
Real life, and we keep the hooks. Why? Because he's old and he has to be easy to take out, put it in. Nothing very complicated, but make it simple. The patient asked, please make it simple. I think it was quite simple.
Think before, and we will earn some time in order to have a good treatment on the patient, and it will spend less time in your office than before, thanks to the digital tools.
In the masterclass, you will have the patient. You will have your computer to make the working on the computer, on Mojo, on SmileCloud, so you have the hands-on, so that you can see and live with us all this workflow all together, and we will think about the treatment proposition all together. So we count on you. If you come with us, we will take a good complex case and we will transform this complex case in a simple case.
Step by step, understanding what we will do in order to have a good treatment planning session. See you in Florence, in Italy, mid-June.
See you in Florence. Ciao.